Today we're talking about an extremely important issue, chronic pain. Chronic pain affects about a quarter of American adults in the United States. It affects about 50 million people. What is chronic pain? It's when we have a dysfunction in some organ system that gives us an excruciating sensation known as pain. You can get chronic pain from like nerve damage, say you have diabetes or a pinched nerve. You could get chronic pain from tissue damage, such as if you have cancer. And you can get chronic pain commonly as we get older and we tend to get portlier and our hips, our knees, and our spines start to degenerate. Cartilage rubs against cartilage and we get extreme chronic pain. Chronic pain destroys the quality of life for people. It makes it so they often can't get out of their house. They're ruminating about their pain all the time. It makes it very difficult for them to pay attention to their enjoyable activities. So how do we treat chronic pain? And then what are some of the challenges? The treatments we have for chronic pain are not very helpful. We have non-steroidals, such as your Advil, your Naprosyn, your diclofenac. Now, these are modestly effective for chronic pain, but they have a lot of side effects. Believe it or not, just because a pill is over-the-counter doesn't mean that it's safe. About 16,000 people a year die from the non-steroidals, again, from your ibuprofen, your Naprosyn, your diclofenac. People have heart attacks, about 10,000 people a year have heart attacks. People can have kidney damage. I see so many patients in their 60s and 70s whose kidneys are dying from ibuprofen after ibuprofen. And you can get gastritis and a really uncomfortable feeling, and it can lead to bleeding ulcers. So people are using non-steroidals for the chronic pain, but it's really, really damaging. And ideally, they shouldn't use them week after week, month after month for the long term. Of course, your chronic pain is here to stay usually. That's why it's chronic pain. So the question is, what do you do? Other people try Tylenol, otherwise known as acetaminophen. Now, Tylenol is very, very modestly effective. It's much actually better at destroying your liver than it is at helping with chronic pain. People use Tylenol because they can't take the non-steroidals because they have an allergy or their kidneys have already died or they're on a blood thinner or something. But Tylenol does not really majorly help people with chronic pain. It could be added on to one of many things to hopefully help take the edge off chronic pain. Opiates have been the mainstay of chronic pain treatment. You know, the doctors prescribed tons of opiates in the 1900s and early 2000s because they were marketed to doctors, and doctors sort of brainlessly went along with it. They were marketed by Purdue Pharmaceutical, which is the Sackler family. These people are now embroiled in billions of dollars of lawsuits for portraying OxyContin as non-addictive and as effective for chronic pain. It's neither. It's incredibly addictive, which is why we now have so many people addicted to opiates, part of why. And it also contributed mightily to the opiate overdose crisis. Ironically, even though so many people are using opiates for chronic pain, opiates have not been proven to even be effective for chronic pain. And the problem is we start people on opiates and they get stuck on the opiates and they need to continue on the opiates and they get really sick once they stop taking the opiates. Furthermore, it's very hard these days to prescribe opiates because the DEA is cracking down on doctors and putting a lot of pressure on us not to prescribe opiates, which makes it very difficult for all the chronic pain people who are stuck on opiates. They can become opiate orphans when their doctors retire or stop prescribing opiates. And then when you're an opiate orphan, you're either addicted to opiates or you have severe chronic pain and you're out of your supply for opiates. What do people do? They can miserably withdraw. This has been associated with suicide and depression, or they can start buying their drugs on the streets. People with chronic pain and people with addiction tend to treat themselves, and if they can't find a steady, safe supply of drugs, they'll start buying the drugs on the street. And then that's how the overdoses go up, because when you buy the drugs on the streets, they can be contaminated with fentanyl. So we really need to not cut off our opiate orphans, even though I don't really believe in starting people with chronic pain on opiates because they're very, they have a lot of side effects of the opiates. Constipation, loss of sex drive, drowsiness, in addition to the addiction and the overdose risk. For chronic pain, we also have mood stabilizers and anti-epileptics like Topamax, or we use these old-fashioned antidepressants like amitriptyline or nortriptyline or like Cymbalta. There are medications which are antidepressants and anti-seizure medications which can help tamp down the nervous system and help you experience chronic pain in a way that is less painful. These, of course, also have their side effects, and usually we mix all these meds together and each of them take away a small part of the chronic pain. Further down the list is cannabis. The way doctors treat cannabis is they used to dismiss it entirely, and now they're making a little bit of evolution, and they say you could use cannabis if all other treatments have failed. Now, I personally have treated thousands of patients with chronic pain with cannabis, and it is at least mildly to moderately effective, and it helps people, it helps them sleep, it helps them not worry about their pain, and it pretty much improves people's quality of life. So I personally think cannabis, which has its own side effects, of course, like any other drug or medicine, but I personally think cannabis should be much higher up on our list of things that we try with these miserable people with chronic pain. Of course, if you have really, really, really severe pain, like a car accident or a broken bone or post-surgically, then opiates have a role because they are stronger. But again, for chronic pain, we can do much better than opiates. Now, part of the reason why we're so unsuccessful in treating chronic pain is that we treat it as a strictly biological problem. There's tissue damage and we must give a medication so that the brain stops sensing the pain signals as much and the patient doesn't have as much pain. And that's a really, really important component. But in reality, physical pain and emotional pain are really closely intertwined. The mind and the body are connected. Physical pain makes emotional pain worse. Emotional pain makes physical pain worse. Something like 40% of people who suffer from chronic pain have anxiety symptoms and have depression symptoms. Certainly, people with PTSD have much worse emotional pain. I had a patient recently who has been on opiates and working with every possible specialist I can find, including a pain psychologist, which is a really smart way to help. And he recently lost his daughter from leukemia. And just losing his daughter vastly escalated the number of medications he had to be on for chronic pain. The depress and agony of losing someone you love made the chronic pain worse. And then again, the chronic pain makes the mood worse. So when treating chronic pain, we absolutely have to treat a person's symptoms of anxiety, depression, and PTSD because they're two sides of the same coin. I mean, just while talking about chronic pain, I found it to be very culturally dependent as well, which is another component of it's not just your body, it's your mind and your culture and your emotional state as well. Watching births when I was a medical student, some ethnicities would be stoically giving birth without making any cries of pain or not even needing much pain medication, and other cultural groups having the same exact birth would be howling in agony and they sounded like they were dying. And this is really, they can't be, even though physically it's the same pain, they can't be experiencing the same pain because it's really about how the patient experiences the pain as much as how we treat it. So in treating chronic pain, we have to do a really good job of treating the body, treating the physical problem. Is it nerve pain? Is it physical pain? Is it osteoarthritis? And we have to do a really good job of understanding where the patient is coming, how they're thinking about the pain, what's going on in their life. Do they have any psychiatric symptoms? Is there anything that urgently needs to be addressed? And ideally, in treating chronic pain, we treat the mind and the body at the same time. We address psychological problems, psychological symptoms. We throw our best medications, hopefully not using opiates, at the chronic pain. We use cannabis a lot more liberally. It should be much higher up on our earlier we give people because it really, really does help them. And then by working together with a multimodal team of specialists, a pain specialist who can do injections, a pain psychologist who can help with the mind, the body, a therapist who can help with the psychiatric problems, physical therapy, heat, ice, mindfulness. If we do all these things together and look at the body as a whole, we can do a much better job than we do right now to help the 50 million Americans with chronic pain. Thank you so much for listening to my YouTube channel. This is Dr. Peter Grinspoon.